Yeah, so I think, we're in the relatively early stages for cell and gene therapies for Parkinson's disease. I think there's a lot of exciting new activity going on, some of which has been emerging over the last few years, particularly in the gene therapy space. One of my colleagues, Chris Bankowitz, is our Chief Scientific Officer for the Gene Therapy Institute at The Ohio State University, presented results at the American Academy of Neurology with a recent phase 1b trial that was performed using AAV carrying the GDNF gene for regeneration in early to moderate Parkinson's disease patients. I think the early results are quite exciting with the potential to at least maintain stability or reverse some of the features of Parkinson's disease. We have a very large background, not just in gene therapy, but in drug delivery directly into the brain. And that's how primarily we've been approaching the gene therapy for Parkinson's disease with the direct delivery of viral vectors carrying specific gene product or genes, sorry. The some of the issues that we're sorting out right now is how much coverage do we need? What are the ideal targets? And what are the ideal genes moving forward? Some of these will clearly be regenerative, like the GDNF. Some of these will be symptomatic, and potentially those would fit better with later stage diseases where there may not be the regenerative capacity. And so I think we're going to really learn more and more in the near-term future about how to idealize or personalize each of these therapies to the specific patient. So I think there's some delivery issues, there's some target issues, meaning where are the ideal places we need to treat, and what are the ideal gene therapies for the specific patient along the continuum of disease. I think what gene therapy provides us is a new opportunity to really target the specific problem of the disease at its core. And I think in Parkinson's and other diseases, it now allows us to treat disorders of the nervous system that were previously untreatable, or disorders in the nervous system that were not perfectly or well treated in the past. And this really revolves around the ability to go very specifically at the core problem of these diseases, including Parkinson's disease. No, I think we're living in a very exciting time. Gene therapy provides us the opportunity to really potentially do transformative treatments that weren't available 25 years ago or 10 years ago, depending on how we want to deliver and how we want to and what genes and issues we're going to be targeting moving forward. So I think we're living at a really exciting time. We're really at an inflection point for the ability to treat diseases in a very different way than we have in the past. Yeah, I think these and other centers around the country will be presenting and publishing data across a wide variety of neurologic diseases in the next several years. But I do think these findings from these early first-in-human trials will continue to emerge on a pretty frequent basis, across neurologic disorders. So I think just to keep on the lookout for these results being published as they come out. So.